Hi guys, good time of the day. Let's wait just a few seconds for other people to arrive. Then we will kick things off. While we do, drop a comment here that you are present and hit a plus button if you can see and hear me. Okay. Plus. Okay, everything looks great. Let's wait just a few more minutes. So, today we will talk about transforming healthcare with AI, practical examples, and business impact. So first of all, who am I? I'm Alex Gurbych. I'm PhD in AI, CEO and founder at blackthorn.ai. Also, I'm a healthcare and life science solution expert. I have more than 15 years in AI and machine learning, software engineering, architecting, like very different stuff. I led AI teams, I led data teams, software development teams in healthcare, drug discovery, life sciences, smart city projects. My expertise covers computer vision, NLP, data science, and other areas. So let's buckle up. Today we will talk about several applications of artificial intelligence in healthcare. We will talk about predicting readmission risks with AI, AI assistance for medical documentation, AI-powered patient triage or automation of a physician assistant, AI for medical imaging analysis, and generative AI for advanced medical imaging. At the end of the session, we will stop for Q&A, so feel free to type questions in our chat. We will go through all of them at the end of the webinar. First case we will review is predicting readmission risks. First of all, problem statement. 1 out of 5 patients return to the hospital within 30 days after the discharge. 30, 60, or 90, there are different types of readmissions. Single readmission cost in the United States is around 50 to 20K in medical expenses. Oftentimes, it's not covered with insurance. Also, statistically, readmissions led to declines in patient outcomes, high risks of complications, and mortality. So the solution could be to identify patients' likelihood of readmission as input to clinical decision-making and interventions. Do something before the problem arrives, preventing instead of reacting. It's all about AI. So the strategic approach that we took, first, of course, we studied the processes in the hospital. We found out the stages of the business operations in which we can intervene. And then we designed the system in front of you. So there will be a clinical data stored in some kind of warehouse. There will be a smart, intelligent service that evaluates readmissions. And based on this data, it outputs predicted readmission probability per patient in the form of the dashboard. Yeah, the third part of the system is kind of Power BI on top of this AI service and database, which outputs the probability of readmission per patient. Then this information serves as input for nursing staff and clinical people who can use it as a recommended way to adapt their care operations to the state of patients. Here you can see this arrow. And as a result, we expect that something change in these patient outcomes. This is the whole idea of this application. Here you can see the stages of clinical workflow on which we intervene. We have 3 stages of intervention. First is the admission stage. Here you can see the features that we know about patients at that point in time. Admission time is when we have a preliminary diagnosis, and based on this preliminary diagnosis, the first model output is made. In around 5 days, patient receives a final diagnosis. This is where our prediction is refined and improved. And before the discharge, we perform our final estimation of a readmission. It will say whether the patient is ready to go out of clinic or not. Here in front of you, you can see a real dashboard, real applications of patients having some readmission level. You can see the red bars, the yellow bars, and green bars. The green bars are okay. The yellow are so-so, but the red ones are the guys to whom we should pay the most attention. Even more to the right, you can see the features of the model. This is the data the model been trained on. Later, these features are used to investigate the impact factors. So those are like keys we as the doctors can use to change the outcomes. Here are some insights, statistical insights from our work. There are much more. There are more than 50 insights, but overall, we figured out that the patients of age between 30 and 50 have the highest readmission group. Also, the more episodes patients have, the higher the readmission risk. And also the nurse performance is very important. Here you can see one of the nurses had anomalously high readmission rate. So how AI can help, right? So we can anticipate also complaints, think of estimating complications, and backwardly trying to understand where do they come from, these complications, trying to prevent them. Also, AI can help with early diagnostics, detecting the diseases before they arrive, and preventing, not reacting. Feel free to type questions. I already see a few questions in our chat. Please don't forget, be attentive, don't hesitate, don't shy to ask questions in the chat. So we will continue with the second topic. This is AI assistance for medical documents analysis. The pain is known and famous. Doctors hate working with documents and love working with patients. The patients is the area where they can make and won't make impact. The doctors want to spend more time with patients instead of doing some admin work, right? So statistically, almost half of their working time physicians spend on interacting with EHR and other medical documents. As a result, dissatisfactions of doctors, dissatisfaction of patients, because suddenly they cannot get their spot. They have to wait for a visit for days, weeks, and months, because doctors are overloaded, and doctors are overloaded not with other patients, they are overloaded with reading and writing documents. So the solution could be automate data input and extraction to and from medical documents with AI. So let's talk about these two sides. The first side is information extraction from the document. Imagine a doctor preparing for a consultation or a first visit of a patient. To make this visit efficient and to make the diagnosis right, doctor has to study sometimes dozens of different documents, previous visits, etc., etc. It takes hours. So what we propose here and what we've built, this is one of the real applications that we delivered. So here, this is a patient profile, and you can see different documents uploaded which are related to this patient. And at the top, at the bottom right corner, you can see this figure of AI assistant. This AI assistant can answer questions. So doctor can, instead of looking through all of these documents, can ask what he or she interested in. For example, here it's a history of hospitalization. And AI assistant will go to these documents, screen through, and bring the result. As you can see here, this is the history of hospitalization of this patient. From all of these documents, we're now working on adding references here, so that the user or a doctor can go there and find this place in each document to make sure and verify everything. But overall, you just saw the way how the doctors can cut their reading time from hours to minutes just by getting a quick summary produced by AI. As for the other side, filling medical forms with voice, clinicals can fulfill these forms with voice, and AI also can pre-fill these forms automatically with findings, diagnosis, and doctors just can fix them. Again, as in previous cases, don't forget to ask questions in the chat. We will talk about the questions at the end of the webinar. Now, topic number 3, AI assistant for patient triage, or automation to some extent of a physician. Here you can see another real application that we developed and delivered. Here you can see such repetitive functions of general practitioners as renewal of prescriptions, consulting on symptoms and complaints, discussion of analysis and research results, and questions related to pregnancy, children health. So all of these are specialized AI assistants, which in the form of a live chat can address these concerns, questions, renew prescriptions. Of course, these results will be sent to a doctor in a short format, and the final decision will be made by the doctor. But still, first of all, they work 24/7. Second, it will save a ton of time for general practitioners. So to summarize, doctors can focus on taking care of patients instead of doing administrative work, and AI can consult a patient on prescriptions, symptoms, complaints, and other types of care, other topics which are usually answered by a receptionist or therapist or general practitioner, thus relieving these people from these repetitive and boring tasks and allowing medical professionals focus on their duties, being more time with patients, making impact, instead of doing paperwork. As a result, AI can collect and analyze symptoms and navigate patient to the right medical specialist. I will share the slides after this webinar, and you will be able to try this program using this link here. Again, don't forget to ask questions. I see a couple of people typing. Thank you. AI for medical imaging analysis. This is the fourth topic for today. In front of you, you can see another application that we've delivered. Here, this application works with mammogram and ultrasound. You can see here detected malignant and benign anomalies, statuses of analysis in this widget, and here you can see recommendations. So the detected lesions, their severity and type and progress level, they lead to typical recommendations of a doctor. In this case, the malignant anomaly detected led to a suggested action of biopsy, which program made automatically. And me as a user, as a patient, I can open this mammogram. The program will point me to the place, to the finding, which I can review myself. Now we will talk about the two modalities implemented. First of them is mammogram. Here you can see the 4 views of mammogram. Upper left, upper right, left side, and the right side. And the severest level of a lesion detected on each of the modalities. And also, but very important, is confidence level. So the typical question is, how do you know that is it a correct prediction, right? Because AI make mistakes. Yes, I make mistakes, but we can get additional information to get extra information on this case. In this case, this is a probability. If a probability is low, then this prediction can be better, right? But if it is high, like 80% and higher, 70% and higher, then it is reliable. And here you can see different suggested actions like re-examination in 6 months, which usually made by the doctor in this situation. For the doctor now, it is only click agree button, and it saves time. Here in front of you, you can see the actual analysis performed. You can notice here a breast density D in this case and a red mark over there. It means the high density level decreases the sensitivity of methods, including AI. So this is additional signal for the doctor for his or her decision. At the right panel, you can see the four views of a mammogram and detected lesions by AI in each of the views. And at the center, you can see the two views, two forms of AI. One is a heat map. Heat map is a density probability distribution over the image. The closer the color to the red, the higher the probability that there is something wrong in this region. This is easy navigation for an eye, of a doctor's eye. And to the left, you can see the simplified form with rectangles. Again, our major goal here was to help doctors with some guidance for an eye, to help them to not miss anything, especially when they're tired. And for the patients, this is the way to get a second opinion. Sometimes they are not happy with what they heard from doctors, and this tool can help them to get an alternative opinion. Also, you can see here probabilities of each lesion detected, and we are working currently on the type. Like, is it a calcification? Is it architectural distortion, and other types? But let's talk about another modality. This is ultrasound, the same table as before, but you can notice here one of the malignant lesions were detected here with a very high probability, and the program automatically recommended biopsy of this region. Let's review it. Here you can see this carcinoma detected with a high probability. Again, we're working on the type. But here you can see the segmented part of the screen, which shows the actual carcinoma. Again, feel free to ask questions in our chat while we are talking about the fifth and the final topic for today. This is generative AI for medical imaging analysis. So if earlier we talked about the AI imaging analysis, which is frankly not super new. Yeah, it's been here for 30 years. But if we add generative AI on top, then it gives us some kind of superpowers, which you will see now. The idea is that patients can get a consultation on their condition immediately. So it will not be an image like in previous case, which requires some extra effort, some additional effort in explanation, but the patient will see findings and all the concerns addressed right now. For example, for X-ray here, the AI can consult on the severity of this condition, impact on daily life, prognosis of development of a disease, suggest treatment options and prevention, as well as suggest next steps. In this case, it was a benign formation, and AI suggested a re-examination in 6-12 months, which is completely legit for this case. And pay attention to personal recommendation. Usually patients are very worried, what should they do now? And they already have this information here. And as a summary, the overall health status based on the diagnostics. So to summarize, AI assistant for radiologist is a razor-sharp decision-making empowered by AI. Statistically, cancer misdiagnosis occurs in up to 44% of cases. With the accuracy that we talk to people is around 70%, manual, the doctor ones, right? The studies show that A doctor combined with AI can make a 20% better decision. So accuracy of a doctor grows by 20% by working with AI. So AI allows doctors to achieve 90 and above accuracy in diagnostics. The major sources of error is declining accuracy of doctors toward the end of the day when they are tired, so due to fatigue. Also, a time of care is critical, and a typical problem is unavailability of experienced radiologists. People are waiting for their visit, and their condition does not allow waiting. They don't have this time. They need doctor now, which AI can help with. You can have a doctor and diagnostics like right now. In Europe, the 2 rads are required to confirm the diagnosis, which makes this problem even worse because the availability of doctors then even lower. And also the diagnostics is very personal based. So you can show the same case to 2 doctors and get 2 different diagnoses, which is a known problem. And that's why the trust of patients and people to doctors is declining in some regions. As opposed to human-based analysis, AI provides immediate and evidence-based second opinion on a patient's condition, assisting the doctor and efficiently decreasing the chance of a wrong diagnosis, either as a guidance for an eye or as a second opinion, a separate tool for patients. Overall, research shows that AI gives a 20% cancer diagnostics accuracy boost if doctor uses AI. So takeaways, and the question which I most often hear talking about AI in healthcare: will AI replace doctors? So the answer is yes and no. No, because humans will always need a human touch. AI will never replace it. And yes, because AI makes doctors more efficient. AI makes doctors faster, more accurate, more attentive. It allows them to do more work. And if one doctor can do more work with AI, then the less doctors is needed. This is first. And second, doctors who know how to use AI and use AI in their practice now are just more skilled doctors than typical ones. So think about it. You need new skills, guys. Doctors. It's time to learn AI. Q&A sessions. Now I will review questions which I received in the chat. Okay, and the first question that I see is, what are some of the most successful examples of AI implementation in healthcare that you can cite, and what results exactly have they yielded? So today we talked about the medical images examples. Those are very popular ones. You saw mammo, you saw ultrasound, but also the very popular are X-rays and MRI, like lung cancer. So the benefit is first reduced time to diagnosis and increased accuracy. I can give you some exact cases. For example, IBM Watson Health AI in studies demonstrated accuracy of up to 95% in comparison to typical in industry 75% cancer diagnostics. Another problem was with MRI. The MRI is a very time-consuming procedure. People stuck in this tube for almost an hour, and every rotation of a leg or a body, it ends up with blurred images. So MRI combined with AI for image improvement. This is the technology in which AI on the fly, like in your iPhone, improves image. It reduces the time of this procedure to 20 minutes, sometimes 30 minutes, so almost twofold. So imagine you can have 2 times more MRI patients with AI and with the same high quality images as outcome of it. So this is 2 cases of a real impact of AI studied and documented. Okay, second question is, how does the AI integration specifically improve the quality of patient care and their satisfaction with healthcare services? We can take as an example integration of AI for predicting healthcare outcomes. Studies have shown that patients who receive personalized treatment plans based on AI have a 50 to 20% higher chance of recovery. At the same time, patient satisfaction increased by 25% when they use AI technologies for healthcare services. So there is some real evidence that generated by AI plans, personalized treatment and condition-based, are more effective and people are happier with them. Okay, the third question is, what business impact can be expected from the implementation of AI in healthcare institutions, and how will this affect overall healthcare spending? So we know that especially US healthcare spending is insane. First of all, it's chaos, and there is a very big leakages of finances to some administration overhead. Remember we talked about AI which worked with documents? So this one and this one. So these are the examples of how AI will improve the administrative overhead. It is estimated that it will reduce from 15 to 30% of administrative work, efficiently saving 150 billions or something like that. Also, and the treatment costs due to this administrative overhead reduction will drop by 20%. This is expectation of like Deloitte and other consultants. I hope that they are true, but of course the exact numbers we will know in year 2026 for which the predictions were made. Okay, so these are the major questions covered. Here are my contacts. First of all, thank you very much for attending the webinar. If you have more questions, feel free to contact me at LinkedIn. It's Alex Gurbych. Here you can see my link, or drop them by email. Thank you very much and see you next time.